Have you recently been prescribed pantoprazole, or are you already taking it and now feeling concerned after hearing about warnings from the FDA and MHRA? Reports of increased risks such as bone fractures, vitamin B12 deficiency, low magnesium levels, and Clostridium difficile-associated diarrhea can be alarming. Some even ask if it could be linked to stomach cancer. In this video, I'll walk you through exactly what pantoprazole does to the body, including the side effects and what you need to know to make informed decisions about your health. And if you stay with me until the end, I'll answer the most common questions I hear from my patients in the clinic. Let's begin with the basics. What is pantoprazole and how does it work? It reduces the amount of acid your stomach makes. It's used for heartburn, acid reflux, and gastroesophageal reflux disease, or GORD for short. GORD is when you keep on getting acid reflux. It's also taken to prevent and treat stomach ulcers. And sometimes pantoprazole is taken for a rare condition caused by a tumor in the pancreas or gut called Zollinger-Ellison syndrome. So how does it work? It's a type of medicine called a proton pump inhibitor. Proton pumps are enzymes in the lining of your stomach that help it make acid to digest your food. Pantoprazole prevents proton pumps from working properly, so this reduces the amount of acid your stomach makes. So who cannot take it? It's not suitable for some people. To make sure it's safe for you, tell your doctor if you have ever had an allergic reaction to pantoprazole or any other medicine. If you have liver problems, if you are pregnant, trying to get pregnant, or breastfeeding, or you're due to have an endoscopy. If you're going to have an endoscopy, ask your doctor if you should stop taking it for a few weeks before your procedure. This is because it may hide some of the problems that would usually be spotted during the endoscopy. So how and when do you take it? You'll usually take pantoprazole once a day, first thing in the morning. If you take it twice a day, take 1 dose in the morning and 1 dose in the evening. So what is the dose? Each tablet contains 20 milligrams or 40 milligrams of pantoprazole. You can buy pantoprazole 20 milligram tablets from pharmacies. These are suitable for the short-term treatment of heartburn and acid reflux in adults. And the usual dose to treat heartburn and acid reflux is 20 milligrams a day. For gastroesophageal reflux disease, it's 20 milligrams to 40 milligrams a day. For stomach ulcers, it's 20 to 40 milligrams a day. And for Zollinger-Ellison syndrome, it's 40 to 80 milligrams a day. And this can increase to 160 milligrams a day, depending on how well it works for you. Now, doses are usually lower for people with liver problems. So how do you take it? It's best to take it an hour before a meal. Swallow the tablets whole with a drink of water. So when do you start to feel better? Now, you should start to feel better within 2 to 3 days. It may take up to 4 weeks for it to work properly, so you may still have some symptoms during this time. Now, if you bought pantoprazole without a prescription and feel no better after 2 weeks, tell your doctor. They may want to do some tests or change you to a different medicine. So what are the common side effects? These include headaches or dizziness, diarrhea, nausea, constipation, sleep disturbances, or feeling tired. So what are the serious side effects? These are rare, but call a doctor straight away if you have joint pain along with a red skin rash, especially on parts of your body exposed to the sun, such as your arms, cheeks, and nose. These can be signs of a rare condition called subacute cutaneous lupus erythematosus. This can happen even if you've been taking pantoprazole for a long time. If you get stomach pain that gets worse, the whites of your eyes turn yellow or your skin turns yellow or dark pea, these can be signs of liver problems. If you pain when you pee, peeing less than usual, lower back pain, swollen ankles and rash or a high temperature, these can be signs of a kidney problem. If you get severe or persistent diarrhea, this can be a sign of an inflamed bowel. And in rare cases, it's possible to have a serious allergic reaction to pantoprazole. Now, these are not all the side effects. For a full list, see the leaflet inside your medicines packet. So what are the cautions with other medicines? Some medicines and pantoprazole can affect each other and make you more likely to have side effects or stop one of the medicines working as well. So tell your doctor if you're taking any of these medicines before you start your treatment. Antifungal medicines such as itraconazole, ketoconazole, posaconazole or voriconazole, fluvoxamine, an antidepressant, methotrexate, a medicine used to treat cancer, psoriasis and rheumatoid arthritis, HIV medicines, rifampicin, an antibiotic, medicines that help to prevent blood clots such as warfarin. So now let's answer some questions I get asked in my clinic, such as, can you take it for a long time? Now, if you've bought pantoprazole from a pharmacy without a prescription, don't take it for more than 4 weeks without speaking to your doctor. If you take pantoprazole for more than 3 months, the levels of magnesium in your blood may fall. Low magnesium can make you feel tired, confused and dizzy, and cause muscle twitches, shakiness and irregular heartbeat. If you get any of these symptoms, tell your doctor. Taking pantoprazole for more than a year may increase your chances of certain side effects, and the FDA and MHRA have warned against this, and I will leave a link to these down below. The warning includes the possibility of bone fractures, gut infections such as Clostridium difficile-associated diarrhea, vitamin B12 deficiency. Symptoms can include feeling very tired, a sore and red tongue, mouth ulcers, and pins and needles. So if you take pantoprazole for longer than 1 year, your doctor will regularly check your health to see if you should carry on taking it. So does taking pantoprazole for a long time cause stomach cancer? There is mounting evidence to suggest people taking medicines that reduce stomach acid, like proton pump inhibitors such as pantoprazole and H2 blockers, might have a very small increased chance of developing stomach cancer. It could be more likely in people taking them for longer than 3 years. But studies involving more people need to be done to be sure that these actual medicines cause stomach cancer rather than something else causing it. And all medicines can have side effects, so it's best to take them for the shortest time possible. And it's important to speak to your doctor if you notice any of these symptoms which can be signs of stomach cancer. So these include having problems with swallowing, feeling or being sick, feeling full very quickly when eating, losing weight without trying to. So how do I stop taking pantoprazole? Usually you can stop taking it without reducing the dose first. But if you've taken pantoprazole for a long time, speak to your doctor before you stop taking it. Stopping suddenly could make your stomach produce a lot more acid and make your symptoms come back. Reducing the dose gradually before stopping completely will prevent this happening. So are there similar medicines? There are 4 other medicines that are similar to pantoprazole. These include lansoprazole, omeprazole, esomeprazole, rabeprazole. Like pantoprazole, these medicines are proton pump inhibitors. They work in the same way to reduce acid in your stomach. They gradually work as well as pantoprazole and have similar side effects. However, they may be given in different doses to pantoprazole. Sometimes, if pantoprazole is not working for you or you get side effects, your doctor may suggest that you take another proton pump inhibitor. Now, if you'd like to learn more about omeprazole, I have a video that I will leave a link for in the description box down below. Now, are there other indigestion medicines? There are other prescription medicines and ones you can buy that treat indigestion and heartburn, such as antacids. Antacids like calcium carbonate, sodium carbonate, Malox, and milk of magnesia relieve indigestion and heartburn by reducing the damage of acid in your stomach. They give quick relief that lasts for a few hours. They are ideal for occasional stomach acid problems. Some antacids, such as Gaviscon, have an extra ingredient called alginic acid. They work by lining your stomach so that juices from it don't splash up into your food pipe. They're especially good for relieving acid reflux. Antacids are available from pharmacies and supermarkets. And H2 blockers. Now, these are histamine antagonists, commonly called H2 blockers, and they reduce the amount of acid in your stomach. But they do this in a different way to proton pump inhibitors, and they include famotidine and cimetidine and nizatidine. In general, proton pump inhibitors like pantoprazole are used first because they're better than H2 blockers at reducing stomach acid. However, if a proton pump inhibitor doesn't suit you, for example because of the side effects, your doctor may prescribe an H2 blocker. Can I take pantoprazole with an antacid? Yes, you can take pantoprazole with an antacid like Gaviscon. Can I take painkillers with it? Yes, it's safe to take painkillers such as paracetamol or ibuprofen at the same time as pantoprazole. It's best to take ibuprofen with or just after a meal so it doesn't upset your stomach. Can I drive or ride a bike? Now, pantoprazole can make you feel dizzy or sleepy or affect your vision. If this happens to you, don't drive, cycle, or use machinery or tools until you feel better. Now, is there any food or drink I need to avoid? Now, you can eat and drink normally while taking pantoprazole, but it's best to take it an hour before a meal. It's best to avoid foods that seem to make your symptoms worse, such as rich, spicy, and fatty foods. It also helps to cut down on caffeinated drinks such as tea, coffee, and cola, as well as alcohol. Now, I hope you enjoyed this video. Please remember to hit the like button and hit the subscribe button if you'd like to see new videos that are posted every week. And hit the notification bell if you want to get notified about new videos. Please make a comment in the comment section to tell me what you enjoyed about this video or what topics you'd like to learn more about. You can also check out my other videos or playlist on medication side effects. Thank you for watching.